Good morning and welcome to the Fulton County Board of Commissioners recess meeting. Today is September 16th, 2020. It is 10:00 a.m. Madam Clerk, would you call the roll for purposes of a quorum, please?
Chairman Rob Pitts.
Present.
Commissioner Liz Hausman.
Present.
Commissioner Bob Ellis.
Present.
Commissioner Lee Morris. Commissioner Natalie Hall.
Present.
Vice Chairman Marvin Arrington Jr.
Present.
Commissioner Joe Carr.
Present.
Mr. Chairman, you have a quorum.
All right, please rise wherever you are for the invocation followed by the Pledge of Allegiance.
Let us pray. Almighty God, we are thankful for this day, for your grace and mercy upon our lives. We pray for a blessing for those who are experiencing difficulty this morning. We pray for our state, our nation. We ask now, Lord, that you give our leaders your wisdom and your direction. It is in your name that we humbly pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
It's a hard time finding the flag. I was like, wait, really? What am I looking at?
Madam Clerk.
On page 2, consent agenda. 20-0628, adoption of the consent agenda. All matters listed on the consent agenda are considered routine by the County Commission and will be acted by one motion. No separate discussion will take place on these items. If discussion of any consent agenda item is desired, the item will be moved to the recess meeting agenda for separate consideration.
All right, any items on the consent agenda need further discussion? If not, I entertain a motion to approve.
Move approval.
We moved in second. Let's vote, please. Commissioner Hausman. Commissioner Ellis.
Excuse me, question. We had an item that was removed. Is that still removed? Item 0655? I had a memo on that.
That's not on consent.
It's not on
On the
the.
regular agenda. Thank you very much. Yes.
All right, Commissioner Hausman votes yes. Commissioner Ellis votes yes. Commissioner Morris.
Yes.
Commissioner Hall.
Yes.
Commissioner Arrington.
Yes.
Commissioner Carn.
Yes.
All right, now I vote yes.
And motion passes unanimously.
All right. Continue, Madam Clerk.
If there are items to be added to today's regular meeting agenda as requested by the county manager for registration and election, on page 2 of the add-on memo, there are 4. The first item is 20-0657. Request approval of a contract with Radio 1 to provide radio and digital advertising to educate voters about the November 3rd, 2020 general
How
election.
many are there?
4.
Are there 4? Those all relate to elections.
Yes.
And they're all time sensitive. Sound them all together, please.
Okay, 20-0658. Request approval of a contract with Cox Radio to provide radio and digital advertisement to educate voters about the November 3rd general election. 20-0659. Request approval of a contract with Intercom Communications Corp. to provide radio and digital advertising to educate and inform voters. And 20-0660. Request approval of a contract with Outfront Media to provide radio and digital advertising to promote voting options.
Mr. Chairman, I'll move that all 4 of these items be added to the agenda.
All right, all right, properly moved and seconded. Let's vote, please. Supermajority, 5 yeas. Commissioner Hausman,
Yes, I'll vote yes for discussion.
Commissioner Ellis, Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Commissioner Carn.
Yes.
All right, now I vote yes.
Motion passes 6 yeas, 0
Thank you.
nays. And on page 5, adoption Recess meeting agenda 20-0640. Mr. Chairman and members of the board, we have amendments to today's recess meeting agenda. On page 6, item to be removed, 20-0655. Request ratification of countywide COVID-19 emergency procurements. There are no emergency procurements to report at this time for COVID-19.
Remove,
We're removing it, yes.
okay,
We're moving up items on page 8, as requested by the chairman, 20-0622. Requested.
okay, on 200622. Now, at the request of Dr. Paxton and the manager, they've asked for additional time to work this out. And so they've asked me to remove this item, but to be prepared to bring back their recommendations for this transfer, this transition at our second meeting in November in time for the 2021 budget discussion. So I will not object to it being removed today, but we will come back with a new legislation at the November 18th meeting. So let's remove that one for today.
Okay, so
All right.
noted.
And the next one?
Next item to be moved up to be heard after public comment, 20-0652. On
Okay,
page
on
8.
that one, we will be entertaining a Zoom call from London, England, sometime this morning, so probably in the 11:30 timeframe. So I'd like to have your permission to take that up whenever Dr. Shapiro is available for us for about a 5-minute briefing from him on the sound diplomacy study, which each of you should have received a copy of. Okay.
And those are the amendments I have today.
Okay, and a couple of other things. We have 2 interviews scheduled today for position of clerk to the commission. And so in order to accommodate their schedules, they're on notice. So we probably need a hard stop for lunch and executive session around 12:45 or no later than 1 o'clock, because these interviews are scheduled to begin. I think the first one begins at 1:30. We'll need to talk with the consultant prior to the first one, and the second one will begin at 2. Then we have other matters to take up in executive session. So if y'all will bear with me, that's how we'd like to proceed for today. All right, Madam Clerk.
Okay, and
Mr. Manager, we're gonna need you and your staff on the report. You can help us out. We have a lot going on today.
Well done.
Mr. Chairman, one question.
Yes, sir.
So after executive session with the interviews, are we gonna continue with the rest of the agenda? Or are we gonna try to finish up everything before we go into the interview?
I would be thrilled if we could finish beforehand, but that's not likely. So we'll come back after executive session and finish the agenda.
Okay.
Yes, sir. Okay, Madam Clerk.
okay, we need to vote, please.
All right, Mayor, entertain a motion on the agenda as
So
amended.
moved as with those amendments.
Second.
Properly moved in second. Let's vote, please. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall,
yes,
Vice Chair Arrington,
Yes.
Commissioner Carn.
Yes.
All right, and I vote yes.
And the motion passes unanimously. Continuing on page 5, 20-0641, ratification of minutes, recess meeting minutes, August 19th, special call meeting post-agenda minutes, August 28th, and regular meeting post-agenda minutes, September 2nd, 2020.
All right, is there a motion?
So moved.
Here's second. I'll second. Let's vote. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris, Commissioner Hall,
yes,
Vice Chair Arrington,
Yes.
Mr. Carn,
Yes.
and I vote yes.
And the motion passes 6 yeas, 0 nays.
Did you send copies of the minutes to the mayors,
I
correct?
will want, since now that they're ratified.
Okay.
20-0642, presentation of proclamations and certificates. First proclamation is recognizing Minority Business Opportunity Week, sponsored by the full Board of Commissioners.
All right. Are you reading it, Mr. Clerk, Madam Clerk?
Daryl?
No, I'm going to read it, sir.
Okay.
Whereas the Georgia Minority Supplier Development Council, Georgia's leading small business development and supplier diversity organization, has certified minority business enterprise firms develop their capability, capacity, and competency, and facilitate partnerships with corporations and governments in needs of their goods and services for 45 years. And whereas in 2012, the GMSDC entered into a partnership with Fulton County in which the Fulton County Department of Purchasing and Contract Compliance utilizes GMSDC certification to register an MBE firm within the county's purchasing system, which abbreviates the application process to one page and eliminates redundant paperwork. And whereas in 2019, the GMSDC helped MBE firms create 130,000 jobs, generate $5.4 billion in wages, and contribute more than $13 billion in gross domestic product in Georgia. And whereas the GMSDC continues to support Georgia's MBE firms through its various signature events and educational programs designed to provide opportunities for growth, success, and long-term sustainability. And whereas during the week of September 14th through the 18th, 2020, the GMSDC will host its annual Business Opportunity Exchange to stimulate opportunities and to explore ways for minority businesses to do business with corporate and governmental supply chains. Now, therefore, be it resolved that the Fulton County Board of Commissioners commends the business opportunities extended by the GMSDC and honors the achievements of minority businesses and their importance to our economy, and does hereby proclaim the week of September 14th through 18th, 2020 as Minority Business Opportunity Week in Fulton County, Georgia.
Next.
Next proclamation is recognizing Elizabeth Strong Appreciation Day, sponsored by Chairman Pitts.
And for your information, she is the mother of our distinguished purchasing director, Felicia Strong Whitaker.
Whereas Elizabeth Strong was born in 1938 to Maud and Reuben Gant in Brantley, Alabama, and the family moved to the Cary Park community of Atlanta, Georgia in 1942. And whereas Ms. Strong attended elementary school in a one-room schoolhouse until William J. Scott Elementary School was built, and later graduated from Henry McNeil Turner High in 1956, then in 1979, earned her paraprofessional degree from Georgia State University. And whereas Ms. Strong has been an elections poll worker since the late 1960s and a community organizer and advocate for over 20 years through her work with the Economic Opportunity of Atlanta for underserved communities, and she received the Coretta Scott King Award for voter registration in 1988 for registering the most new voters, and has continued to advocate that all people exercise their right to vote. And whereas Ms. Strong is effectively known as Doot by close family and friends, and she is the mother of 3 daughters, Felicia, Valerie, deceased, Valicia, and 5 grandchildren and 10 great-grandchildren with whom she enjoys spending quality time and upon her retirement, she plans to spend more time with her family in addition to her favorite hobbies of modeling, of gardening rather, and reading. Now, therefore, be it resolved that the Fulton County Board of Commissioners and all associated with the Tax Commissioner's Office commends the dedication exhibited by Elizabeth Strong during her 33-year tenure with Fulton County government, and expresses our congratulations upon the occasion of her retirement, and does hereby proclaim Tuesday, September 1st, 2020 as Elizabeth Strong Appreciation Day in Fulton County, Georgia.
Congratulations, Ms. Strong. All right. Continue, Madam Clerk.
Bottom of page 5, public hearings, 20-0643, public comment. Citizens wishing to participate in public comment, register online to join the public comment portion of the call, can submit or fill out the form located on the county website, www.fultoncountyga.gov, Speakers will be granted up to 2 minutes each. Public will not be allowed to yield or donate time to the speakers. The public comment of a portion of the meeting will not exceed 30 minutes.
Mr. Carver?
We have 3 comments from the email. So the first of these is from Cassandra Kirk, Chief Magistrate, Judge, and Court Administrator. Good morning, honorable members of the Board of Commissions. I write to share the latest award presented to the Magistrate Court of Fulton County and highlight in Rolling Out magazine. The research staff at the Administrative Office of the Courts presented the Magistrate Court of Fulton County with its Clearance Rate Excellence Award. This award acknowledges courts that are keeping up with their incoming caseloads. Courts strive to reach 100% clearance rates. In this case, the Magistrate Court of Fulton County, one of the highest volume courts in the state of Georgia, received the award for its past 3-year clearance rate average, which was 254%. The Magistrate Court of Fulton County is honored to share this award with you and all credits its judges, interns, and court administration for making these achievements possible. The second of the comments we have is from Madeline Smith from College Park. Greetings, Commissioners. First, thank you for the work that you do for the citizens of Fulton County. I send concerns about the September 14th Board of Elections meeting held this past Monday. Having had a conversation with a member of Common Cause prompted me to sign into the Board of Elections meeting. Why? Because the forgotten who are incarcerated in jails in Fulton County and throughout Georgia have voting rights. Phone calls were made to registration and elections offices Friday, September 11th. Pamela Coleman was spoken to by a citizen expressing concern as relates to what's in place for inmates in Fulton County to vote. Pamela did certify that anyone without a felony record could vote. Okay, great. But what's in place for inmates in Fulton County jails / prisons who meet the criteria and have been accused but not yet convicted of a felony, or are awaiting a trial, or are incarcerated because they could not get bond money to be released as they await a trial. Brenda McLeod on Monday, September 14th, was spoken to about public comments at the meeting concerning this issue. Public comments were sent in about this. Phone calls since the Monday meeting have been placed to answer the question about voting rights of Fulton County incarcerated. No one is returning calls. We thank both Pamela and Brenda for their initial reactions, but follow-up is required to get answers to the question, what is in place for incarcerated accused felons and also non-felons in Fulton County jails and prisons to exercise their right to vote. Again, as citizens, we quote Fannie Lou Hamer, "We are sick and tired of being sick and tired, especially as the poor and marginalized, 99% of whom are Black and minorities." And the last of the public comments is from Donna Renfro Lawson from Atlanta. Peace selected, elected, and rejected full co-leadership team, subordinates, and family. County Attorney P.P. Hooker is to be recognized and probably awarded with a proclamation of sorts for successfully convincing the county manager, R.D. Anderson, that he does not have to respond to me, Donna Renfro Lawson, about any Fulco constituent related topic. I admit there's an awkward position and probably an incorrect interpretation of as the late great Emma Darnell's warned us on a number of occasions. Hooker's teamwork authority reminds me of a chapter in Different Dances, a recommended reading authored by Shel Silverstein. To not spoil the story, it suggested that at approximately page 178, everyone's silenced by CAPP Hooker's mandate to take some time out to read that portion of the book. It was once on the juvenile and adult shelves of Fulton's public library system. Once again, the book's title is Different Dances. There are 4 C's that everyone should be considerate of communicating with and about, and they are the commissioners, candidates, constituents, and Christ. Commissioner Arrington, I can't vote, and you should know why, and you should be ashamed for not communicating with me and CAPP Hooker's actions and obstacles against us. May the reader of these comments have spoken clearly enough for the proper reception for the listeners' engagement. That's the last of the comments.
Okay, thank you.
And we have one speaker, Mr. Ben Howard.
Mr. Howard?
Yes, thank you. Greetings, commissioners, and greetings also to you citizens of Fulton County. Ben Howard, Senior Advocate public policy analyst. At one time, we were on our way towards certification of our senior multi-purpose facilities. The pandemic has given us an excuse not to pursue that certification. However, we have no excuse for not insisting upon public notification of the meetings of the Commission on Disability Affairs and the Commission on Elderly Affairs. We have over 100,000 senior citizens in Fulton County, and the most I have ever seen visiting a meeting of the Commission on Elderly Affairs at one time has been 5. Did somebody say 5? If we consistently publicize those meetings, we just might be able to increase the number of visitors to the Commission on Elderly Affairs meetings, especially since we can now do so virtually. Thank you.
Okay. Continue, Madam Clerk.
On page 6, county manager items, under open and responsible government, 20-0654, presentation of COVID-19 operational response update.
Mr. Manager?
Yes, sir, Mr. Chairman. Good morning, Commissioners. We will step through this quickly. And again, I'm going to tell you up front in a minute what we're going to say, and then we'll go through the charts again in short order and leave all the time for questions. The big news today is our test results and cases are improving. They were dropping from over 400 a day to 83. More importantly, perhaps the percent positive when tested is dropped from 16% to 5%. And we'll leave that to Dr. Paxton to discuss the importance of that. I think most importantly, Fulton County represents now less than 9% of the state caseload of positive cases. And I've asked Doug Schuster with EMSI to really display for you the importance of that number, because that's half of where we started from when we represented close to 20% at the beginning of the virus of the total caseload in Georgia. And that translated now into a much lower projected death rate, probably over 1,000, that because of your actions and the ability to execute this plan, we will have achieved by the end of the duration of the virus. I think there's always opportunity for some Monday morning quarterbacking in terms of how the CARES funds were deployed, but I can say without reservations, our numbers speak for themselves. And speaking of the numbers of testings, results are now close to 580,000, in fact, exceeding that, which far exceeds our peer counties, as you'll continue to see, which average more like 100,000 to date. And it represents 20 to 25% of all the testing being done in Georgia. We are seeing decreasing demand for testing, so we want to keep an eye on that. Our Fulton Needs You campaign with 130 million impressions should be helpful to drive testing from about 3,000 a day that we're experiencing to what is an upper bound capacity of 8,500. So hopefully our citizens will hear clearly that we have more than enough capacity. You can get an appointment without a problem. And the test results, as Dr. Paxton will talk about, are coming back in a rapid period of time, 24 to 48 hours. So there's every benefit of testing available to our citizens. PPE remains in good shape with approximately 10 million either on hand or committed. We have suspended any additional purchases or further deliveries to the cities as we work the resolution of the CARES discussion today in executive session. We will, in light of all these trends, review with Anna Roach any implications for our reopening plans. The most significant that we'll announce today is the provision of fingerprinting services for concealed carry permit applications at both the North Annex and South Annex location. That'll be a great improvement from having to come downtown for fingerprinting, since most of the other police departments no longer are doing that service during this period. So that will give us 3 locations to accomplish those renewals. I think our library curbside service continues to deliver great value. We'll be initiating conversations with elected officials about their offices in light of these new numbers, but I think a safety first approach still should predominate. One huge good bit of news is our tax bills were delivered. Talked to Dr. Ferdinand early this morning, and they have due dates of 10/31 for the city of Atlanta and 11/15 for Fulton County. So that, again, allows the government to meet its financial obligations without what would have been significant disruption. So we want to thank he and his team for really what was an extraordinary effort through the weekend and over many nights when bills were being printed, when a main printer failed and about 11 printers were brought into service to make that happen. Lastly, we will be prepared to discuss a best and final offer today to our cities in executive sessions for the CARES Fund allocation, and we hope to have that resolved and moving forward. And as has already been reported, we're in very good discussions, I believe, with the Board of Health leadership, and I want to thank Dr. Paxton and Beverly Stanley for engaging on a planning process that will look at the dimensions of procurement, human resources, and finance, and has already been indicated with the thought being that we'll bring back a plan in the November meeting for your consideration. Lastly, again, we continue to keep, I think, the critical functions of government going. There was some question raised in the last meeting about why did we overview some of the capital projects like the atrium, the assembly hall, the courts building, or even the two massive wastewater plant expansions. And the reason is to let you know, and importantly, let the public know that while COVID has disrupted a lot in our society in general and economy, we continue to, while focused on the results that we'll talk about and spend quite a bit of time on in terms of the COVID results themselves, we continue to remain focused on the critical functions of government, which many of these capital programs represent. So with that, Mr. Chairman, we'll start and move quickly through these charts. Anna, if you want to begin, and then quickly pass to Matt and Doug, and then we'll move forward.
Okay, Madam COO, are you with us?
Good morning, Mr. Chairman and members of the board. Thanks for the opportunity to review the COVID report with you this morning. I have no additional comments to the manager's opening remarks, but I would ask Doug and his team to move quickly through their section so we can get to Dr. Paxton and the board's questions. Doug?
Good morning. All right, next slide, please. Next slide. Okay. As the county manager told you, there's very encouraging news on the trends. I thought I would take today's meeting to kind of talk about our worst of times this summer and how far we've come till today. I want to just add that while all these trends are good news, it is in no means a victory dance. We need to continue this and the things that we've been doing to drive these things down, and I'm sure Dr. Paxton will echo that sentiment. So starting off with COVID cases, on July 24th, we were at our high of 400 cases for a 7-day average, and as of Monday, we were down to 87. On July 12th, we were at a high for percent positives on test, and we have dropped from that high of 16% to 5.1% as of Monday. And also, I take note that we're at 8.9% of the Georgia caseload, and that's down pretty significantly from about 15%. Deaths, you can really see how deaths is a lagging indicator, because we were at our high of deaths in August 8th, of 7.6 a day, down to 1.43 on Monday. And Fulton County currently has an 8.74% of the Georgia's death toll. And I'll show you what that percentage means a little later. Hospitalizations, on July 23rd, we were at a high of 600 COVID patients in the Fulton County hospitals, down to 209 as of yesterday. On July 17th, since July 17th, we have added in Fulton County 266 staffed general beds and 23 staffed CCU beds within the county. Decreasing testing demand continues, although over the last 4 days, we've seen a slight increase. which we'll continue to monitor. Also, as was stated, testing results are typically 48 hours or less, more typically in the 24-hour time range. Next slide. This is our dashboard looking at information together on one page. As you can see on the far left in the green, that is our testing. And over the Labor Day weekend, testing was down obviously because of hours. But as you can see for the last 5 days in the far right corner, it looks like we've kind of started to rise a little bit and hit a little bit of a plateau there. So while there has been a steady decrease, it looks like we've kind of leveled off. Cases. Fulton County cases in the orange down to 87 for a 7-day average, and it's stayed that way once again, a little bit of a plateau there. And then the hospital census, the 7-day trend is 221 from a 600 high. And then lastly, you'll see that how the deaths have gone down. And once again, as a lagging indicator, it's been a much more recent trend in that direction, but that is very good news. Next slide. On the left-hand side, you see hospital availability. The numbers at the top in red are when we're in a critically low situation. And it's been a while since we've been that for overall hospital beds. And we are still tracking that. You see over the weekend that we go down in patients in hospitals, and then during the week, especially the non-COVID patient use goes way up, and that creates the kind of wave action that you see on the left-hand side. On the right-hand side, the latest data from the modeling that we process has pushed the projected peak about 15 days to the right, and so now the projected high is now in November. It's also projected at a high of 554 beds, which is down from 843 from the last time we talked to you. A big reason for this, if you see at the top part of the page there, it says projected 554. The big reason for that is, number one, our continued path with the COVID patients has really gone past where they expected the rise to go, but also it relates to the percentage of our hospitalizations from the state's hospitalizations. So that's quite a significant drop there. Next slide. Very similar here. We tend to be on the left-hand side in a little bit more of a shortage situation, but we're in a much better place than we were last time we talked to you. A great deal of this shortage has to do not necessarily with beds available in the CCU units, but staffing with nursing staff to man those beds. On the right-hand side, once again, you'll see the projected height is on November 8th, and that is down from 166 to 131, and for the same reasons I described on the previous slide. Next slide. This is the percent positives for Fulton County. As you can see, it looks like we've leveled off about the 5.1% or 5%, and that is down, like you said, from a high, we said from a high of 16% back in July. And so it's been a very steady decline. The percent positive drop means one big thing to us, that as it drops, our availability and ability to do contact tracing grows with every decrease that we have, and we're able to isolate. So we need to continue to see this number drive downward and get it down as low as we can. Next slide. This is the tracking of the percent of Fulton County's cases compared to the state of Georgia. As you can see, in the first 3 weeks to a month, we were around 15% in both deaths and cases. And then as testing started to ramp up, you see that was really kind of driven down, and it has continued to drive down to below 9%. And as you all well know, we're about 10.1% of the state's population here. So if we can be lower than that 10.1%, that relates to less hospitalizations and less deaths. Next slide. And I think this really illustrates our planning assumption early on was, especially as we were looking at the data, is we were trending at about 15%. So we figured that was because of population density and the social events that happen in urban areas. So we use that as our planning assumption. So if you see, if looking at this slide, you'll see the green is the best case scenario, the solid orange is our most probable, and the red is the worst case scenario. The top dashed orange line is where we would have been if we would continue to that 15% assumption. And then we lowered for almost 3 months, we were using 11.5% because that's really where we were trending at all the time. And you can see that the larger dash line, orange, is at 1640, and now our most probable is down to 1255. And that's pretty significant when you think of being able to make a difference in lives being saved. So I thought it was very interesting to look at this, and it kudos to our testing efforts and the Board of Health and everything that they've done. And I think it's summed up in this slide pretty well. Next slide. Okay, we developed a scorecard. As you can see at the very top, our capability remains at about 8,500 a day, which is an incredible amount to be done. Our current demand is at 2,960, or about 34.8% of our capacity. We would love to be doing 75 to 100%. And so I think the message from the whole team is we need to continue to test because we can catch asymptomatic people, isolate, and contact trace. Time to receive results are in the green, less than 48 hours. Our cases are at 87, but we're not quite in the green. And our percent positives is 5.1, still in the yellow area. Hospitalizations down to 221, and still trending downward. Hospital bed availability is really in a much better place. This is really pre-COVID levels at both bed and CCU bed availability, and our vent availability is in the green. And then our 7-day average on deaths is definitely now in the green, which is encouraging. And our morgue capacity is at 80, which is in the yellow still. So while I've given you good news, there's a lot of yellow on this page. Our goal is obviously to get everything down in the green, and I hope we continue these trends. I'm going to turn the testing slide over to Matt.
Thank you, Doug. Appreciate it. Next slide, please. Matthew Kallmeyer with Emergency Management. Just want to go ahead and showcase graphically what the county manager said in his opening comments. Over 22% of the state's total testing is still being done within the Fulton County borders. Actually, our total cumulative test thus far is actually 590,773. It has gone up since we've drafted this PowerPoint for the BOC's meeting, taking into account yesterday's numbers as well. So once again, looking strong in that regard. You'll see the breakdown of where we stand against other metro counties, as well as in the bottom right, the different areas that we go ahead and we calculate those numbers from the different individuals that are producing or doing testing. As Doug said in the scorecard, folks, we're less than 48 hours when it comes to a turnaround or a test. I can't go ahead and stress enough, and Dr. Paxton will go ahead and echo those comments, that if you think you've been exposed to someone, if you think you actually are in a situation that you may have COVID, please take advantage of our numerous testing sites. Once again, there are 3 fixed sites, one in north, one in central, one in south. Fulton, we also have a total of over 8 mobile units that are actually going throughout the Fulton County jurisdiction. Please go to either the Board of Health's website and click on the banner, go to the Fulton County website and click on the get COVID tested banner, and you'll find out every week where we actually have our units. If we do actually have inclement weather, we will be updating on social media if we have to cancel those mobile units out in parking lots and so on and so forth. But there is ample supply. Please take advantage of that, folks. Last week, Friday, the last thing I want to say is on September 11th was the last day that we actually participated with the Mega Spock that was over at Hartsville-Jackson Airport. That was something that we did along with the Board of Health and Clayton County Board of Health. The numbers were a little shy of what they were hoping for, but still it was a great, less than 19,000 total tests actually accomplished at that, but it was still a great service that we're able to provide the citizens of our area as well as our adjacent counties. With that, I'll actually turn the PowerPoint over to Dr. Paxton to go ahead and walk you through the public health portion of this response to COVID-19. Dr. Paxton. Dr. Paxton, are you on the line?
Matt, if we're missing Dr. Paxton, could you hit the highlights of her notes, understanding that you won't be able to cover all of the potential questions that may arise from them, so we can keep it moving?
Yes, ma'am, I'll do my best. I am definitely not any way, shape, or form the individual that Dr. Paxton is, so I will try to do my best to at least run through her slide while we try to fix her audio difficulties. As you'll see on the screen, folks, testing demand has actually been decreased over the past weeks. We are still trying to figure out why. We are working diligently with our different external affairs partners to get the message out to get tested. I just briefly said that. The capacity is there. Please take advantage of that, folks. Please go to the website to look to where the testing is and come out. The results are, once again, 48 hours or less is what we're seeing as turnaround. So please take advantage of that, especially after we just had that long weekend. If you're around other family members and such, it's a good time to go ahead and take advantage of that. Logistics continue to be optimal. Once again, we talked about the turnaround time. The emergency management team has continued to support our Board of Health partners to ensure that they have the successful resources that they need to operate those locations. I did touch about the September 11th termination of the Mega SPOC. That was a joint effort between ourselves, the Fulton Board of Health, and the Clayton County Board of Health. Those numbers, once again, were a little shy of 19,000 total collected. We were hoping for about 5,000 individuals a day. That's what the capacity was. But once again, the appetite was not there, but the resources were definitely there to go ahead and continue to support that. As you'll see as our next bullet point, there's some clusters that are looking at returning to schools and universities. We know, and is also in the media, that some of our universities, especially with the Greek system, saw an increase in COVID-19 cases. Actually, those have been monitored quite well and handled appropriately within the university system. I'm proud to say that Georgia Tech has a very robust testing and contact tracing program, and they have been able to go ahead and isolate and quarantine, respectively, the students that are actually that were impacted, to go ahead and control that, and they have seen their percent positive numbers decrease because of their efforts. So I commend the Georgia Tech team for what they have done in that regard. We're working very closely with the Atlanta Public Schools as well as Fulton County Public Schools. Atlanta Public Schools is still doing their multiple week online testing process. They're monitoring our numbers very closely, and the new superintendent will be making a decision in the near future as to what they would look like in their new hybrid model. Fulton County Public Schools, as you have heard in the media, is actually doing a hybrid K through 2, bringing some of those students back once a week, and then we'll be expanding it to multiple days during the week, and then continue to grow from there. So a lot of work that's going on there. There's a lot of conversations that I know Dr. Paxton is having with her counterparts from other district health, as well as Dr. Toomey, and working together collaboratively as we move forward in that regard. The MOUs of the City of Atlanta, Partners in Health and CORE, have been signed. I know that they're working very diligently to leverage those funds with the City of Atlanta. I will actually go ahead and allow Dr. Paxton, when she does join us, to go ahead and be a little more specific about how those funds, the CARES funds that the City of Atlanta has allocated, will be leveraged within her organization. The course process, which she's briefed us on before, once again, is to do the contact tracing. Nothing is better than getting someone in there that is bilingual, multilingual, getting into the communities that do not have large amounts of trust for government entities. And that's what we're going to be doing by leveraging some of those partners to get out there, as well as offering wraparound services to these individuals. More than just saying, hey, you have been tested positive, we're going to go ahead and quarantine or isolate you. What resources can we provide you so that you can be successful in this endeavor to make sure that you stop the spread of the virus? As you could see, seasonal influenza vaccination is one of the big things that I know Dr. Paxton and her team is working on. We are actually looking at how can we offer these services at some of our testing locations, whether it be drive-up or the walk-up sites. More to come with that. I know the team is working very diligently along with their Chief Clinical Officer, Dr. Holland, to that end. Mask On campaign is something that you have seen across the country as well as in Georgia, and Dr. Paxton and her team is pushing that. Nothing can go ahead and help us in this moment more than stopping the spread of this, is ensuring that everyone does the proper thing and wearing a mask when they find themselves in a social setting. So please go ahead and continue that. And also, once again, to go ahead and do contact tracing at the SPOCs. There's a lot of emphasis to go ahead and try to capture these individuals early. We've been very successful with the new MS Dynamics system that the State Department of Public Health has rolled out for us, and we have great success, and that helps us with turnaround times at the lab, and we're hoping to take that and continue that initiative when it comes to contact tracing at the specimen points of collection.
Hello.
That is Dr. Paxton, have you joined us?
Sorry, I'm not here. Oh.
Dr. Paxton, have you joined us?
Okay, yeah, sorry. Thanks, Angela. Yeah, my computer just went out. So excuse me for that. Anyway, I'm back in the saddle. So I'll be very brief. As you've already heard, the testing demand at the SPOCs has decreased over the past 2 weeks, but we've had optimal logistics, and our results turnarounds are usually 1 to 2 days, and we always have same-day appointments available. As may or may not have been mentioned before my computer went out, the surge SPOC at the Atlanta airport is over. That finished on September 11th, so we're back to just basically our normal activities. We are still investigating multiple COVID-19 clusters, and those are primarily associated with the returns to schools and the universities. We're not the only district that's having to deal with that, and Commissioner Toomey has set up joint calls between the health directors and the respective superintendents, and our call between Gwinnett, Cobb, DeKalb, and Fulton is going to be, I'm sorry, it was just moved today. It's not going to be on September 16th. It's going to be on September 23rd. So we'll be meeting directly with Dr. Gary McGivney, who is the Deputy State Superintendent at the Department of Education. Our MOUs with the City of Atlanta Partners in Health and CORE have been signed or will be signed today. And as we mentioned before, the covered activities are COVID testing, case and contact investigation, and resource coordination. Now, importantly, I'm also going to go into about mention again the several campaigns. I have a couple of comments to make about all the information that's been presented today. One is that everyone is absolutely thrilled that the COVID rates have been going down recently, but I want to put it all into context. One is that this is actually kind of what is generally the case with respiratory illnesses. As you know, at the end of the summer, that is generally like our lowest peak for any, seasonal flu, for your garden variety cold. So while we're really happy to see this, it doesn't mean that we're out of the woods. So in fact, this is the time that traditionally you put on, you really go pedal to the metal to prevent, to further drive down those rates. And so in that vein, we got a renewed emphasis now on getting masks out to everyone. I think the order for several 100,000 masks is being placed. It might have already been placed this week, and we're going to be starting to get those out. One of the advantages of this is not only do we expect that increased mask use will reduce COVID, it should in flu season it should also reduce our seasonal influenza rates. And related to seasonal influenza, we are actively now working on setting up our a massive push to get seasonal influenza vaccinations out. Now, as we're currently planning this, we're going to take advantage of our SPOCs, and so there will be drive-through and walk-through at our central SPOC, provision of seasonal flu vaccinations. Because of this is an important time to be doing this, CDC has stepped in and has guaranteed us a large number of influenza vaccinations. And after October 1st, we will not have to ask about insurance coverage, which is what we normally have to do. We have to, but after October 1st, for adults, we will not have to ask about insurance companies. So that would be one less barrier for people to get an influenza shot, because this is the time we want everyone to get an influenza vaccination. Of course, we'll also be continuing to have influenza vaccinations available at our clinic. Yeah. So as I mentioned, so we've got the several campaigns that are launching, the seasonal influenza vaccination, which I've just talked to you about, the Mask On campaign, and we're looking into initiatives at the spots to facilitate contact tracing. That's all I really had to say in terms of updates. I did have one interesting sort of scientific tidbit that came out in the New England Journal this past week, which was very interesting. It was kind of it was an editorial that was talking about some new information that's coming out about the benefits of wearing masks. I think everyone knows and has come to accept the fact that wearing a mask definitely helps prevent spread from the person wearing the mask to the person, to other people around him. But there's increasing data that the mask actually help prevent the person who is wearing it. What was particularly interesting about that was the theory that actually, as we know, dose matters. And so if you get a higher dose of this viral inoculum, you actually are more likely to have severe disease. So if you get a smaller dose, the odds are is that your particular case will be less severe than if you got an enormous, if you got a big dose. And so that is one possible advantage to wearing the mask for you, that you're reducing the dose that you're exposed to. The second thing is that, which was I found even more interesting, was the theory that getting a little bit of a dose and possibly even having more chance of having even an asymptomatic infection might actually work in a sort of the way that a vaccine works, in that it's giving you a little bit of a dose of this disease without giving you a full-blown case, and that might actually in the future contribute to herd immunity. Again, this is just a theory, but it did appear in like the most prestigious medical journal here in the United States, and I think it bears it bears watching and further explanation. But it still comes down to the same thing that I say every time I come on: wear your mask. So that is all that I had to say. And again, I apologize for my technological problems that delayed my giving this update.
Okay, thank you very much, Dr. Paxton. Madam CEO.
Questions from the board, Mr. Chairman?
All right, we will entertain questions from the board. Questions? Can't believe it. Going once.
Can you hear me?
Yes, Commissioner Morris.
Yes, a quick question. I'm wondering, I assume it has now been enough time since Labor Day to know whether we saw or are seeing any surge from Labor Day activities. What is your thought about that, Dr. Paxton?
Look, I don't have the figures up in front of me right now. I do not believe that we saw a huge surge. In comparison to what we saw after Memorial Day and what we saw after July 4th, we have not seen quite that same, as far as I know. I'll check with my epidemiologist. We have not seen that type of surge. I like to think it's because that even I noticed, even anecdotally, as I was out and about, I've seen more people wearing masks. And I think that maybe some of the messages got through to some people about, trying to avoid that surge. But I will specifically check, but I don't think that we haven't seen the same surge that we saw after Memorial Day and July 4th.
Yeah, I guess I've also wondered a little bit with the drop in demand of testing, whether folks who might have been too active on Labor Day, maybe they aren't going to get tested.
It could be, you know, and we don't really have a way of knowing, but we do look at those, we look at not only the numbers of people getting tested, but we look at the test positivity rate. So at least we do know that of people who are coming in to get tested, the percent positivity rate is going down, which is an indication that there might be lesser that the transmission, background transmission rate might be going down.
Yeah. Thank you.
Other questions? Okay, I'll take that. No further questions, Madam CEO.
Thank you, Mr. Chairman. Next slide, please. Next slide. I will not spend a lot of time on this slide. I think we have heard a sufficient case being made for the reduction in the number of positive cases within our county. Next slide. One of the things that Dr. Paxton touched on that I'd like to echo is that despite the fact that we have had significant progress on our gating criteria as indicated by the positive indicators, as well as the planned closure of the Georgia World Congress Center on 10/3, as well as Fulton County Schools taking marginal steps to reopen, there are still events out there that cause us to have concerns about just throwing the gates open as it relates to a plan for reopening. That includes the effects of Labor Day festivities that we may not be seeing manifested within our numbers just yet, school reopenings, college football. We're also cautioned by our epidemiology team as well as our EMA team about the effects of upcoming flu season and what that will do to the pandemic spread. As well, we still have a surge of COVID-19 projected for November. So as the executive team thinks about reopening, we do want to be guided by the positive steps or achievements that we've had over the last couple of weeks, but we want to be informed by these continuing concerns as well. Next slide. Taking all of that in mind, we sort of have a red light, yellow light, green light approach to reopening. Not being careful not to make too many plans to achieve too much, and heeding the cautions that we continue to see from the folks that are responsible for providing us information and monitoring the statistics. We are going to continue closure of our senior centers as well as our intellectual and developmental disability service centers. As you know, those services are provided to the most vulnerable populations that we do provide services to, so those will remain closed. Art centers as well, as you know, the services provided through our art centers tend to draw crowds, which is discouraged by our public health professionals while we continue to battle this pandemic. As we thought about what first steps toward reopening phase 2 might be, some of the things we looked at, as mentioned by the manager, is expanding our capacity with fingerprinting by opening 2 additional locations in the north and south annexes of the county facilities. We will be providing those services from 8:30 a.m. to 4 p.m. And the primary purpose of this is to disperse the sort of consolidated crowd that was being driven to 141 for fingerprinting services. So we are proud of both the police department, the probate court, and our Department for Real Estate and Asset Management that have worked together to stand those services up that I believe will begin as early as tomorrow. So looking forward to the results of that. We will be exploring limited administrative services return to office here at 141 Pryor Street, our primary government center. We will still have a guiding principle that telework is the preferred method of delivering administrative services. So to every extent possible, we'll continue to do that. But in order to have some physical presence as a part of the service delivery method, we will be exploring schedules that will allow for individuals to be present here at 141. The third bullet there says exploring a 141 location opening of the tax offices. I will tell you, we have to have continued conversations with Dr. Ferdinand, and I think right now he is seeing this not so much as a possibility because of the strain on his staff with schools still being remote instruction. We do have a challenge with getting staff here in person as well. So he is having to disperse his staff through the locations that are currently open. But again, we will continue to have those discussions, and if it's possible, it will be a part of our first steps for a phase 2 opening, should Dr. Ferdinand agree. The other probably, I think, exciting step that we might take, or that the Chief Judge of the Superior Court is exploring, is a couple grand jury sessions for the fall. Right now, we are in preliminary discussions with the Department of Real Estate and Asset Management to identify locations that could host 2 grand juries that will achieve the social distancing that is necessary to make participants feel at ease about participating in grand jury service. So again, preliminary discussions are being had. We will have much more for you at the next meeting in terms of whether or not we're going to move forward with these first steps to a phase 2 opening. But these are some of the things that we are thinking about. As you know, we'll have continued operations of our essential and emergency operations. Those have not ceased, although some may have been modified. So those will be continued in terms of a green light. And we are continuing our virtual service delivery in many of the health and human services areas that we stood up as a consequence of the pandemic. Next slide. So one of the things we'll continue to report due to interest expressed at the last meeting was it will be the number of COVID positive employees. This slide provides information on the COVID positive employees that we have notice of since the last meeting. We are still trying to get some discipline around directors putting the information in the system so we can track it automatically. So we have a combination of sort of email reporting as well as information being put into our web EOC system. So we're working through normalizing that process. But over the last 2 weeks, we've had 2 positives, one in the Department of Real Estate and Asset Management at our South Service Center, and then as well in the tax assessor's office. Next slide. This has a total cumulative summary of the COVID positive employees. And I just wanted to make note of the fact that when we transfer the information onto this slide, we left off Dream. So the total actually is 116, not 111, because it does include 5 Dream employees. Next slide. This provides a cleaning, facility cleanings and sanitization by department. The reason why it's important to consider this information as well as the number of employees positive is that the facility cleanings will capture non-employee positives that we are required to respond to in terms of a sanitizing protocol. So this will be provided to the board as well as a part of our reopening update. As you can see, this view is by department. And if you go to the next slide, you will see that this view is by cleaning type. So the majority of our cleanings post notification of a positive exposure is the disinfectant wipe down. And that is by direction and recommendation of the CDC guidelines, as well as Dr. Khan in the Board of Health department. Next slide. So I won't go through this line by line, commissioners. As you can see, we do have specific protocols that have been communicated to directors about facility cleaning and what happens when there is contact with a Fulton County facilities. facility. These protocols are adhered to by our DREAM staff. And this gives an expectation to our employee community as well as the directors on what type of cleaning to anticipate based on the type of contact that we have. Next slide. Same with protocols for employee return if there is a suspected positive. If you are an employee, as an example, is positive without symptoms, they are going to be instructed to isolate for 10 days and then return after a positive test. If they're positive with symptoms, there are a certain set of criteria that they will have to follow. But again, Mr. Herman and the HR department have worked diligently to socialize these protocols, not just with directors, but supporting directors to socialize these protocols with the staff as well. As you know, we are, again, primarily in a telework environment, and so many of our employees are already home. So this will apply to employees that are required to be on site for work. Next slide. So that concludes our reopening update. Commissioners, I'm available for questions. Mr. Chairman, if you're ready to lead that.
Commissioners, any questions for the COO?
Can you hear me?
Yes, Commissioner Hausman.
All right, good, because I was trying to ask questions previously and the audio, you know, when I guess you couldn't hear me.
No. So you had questions for the Dr. Paxton.
Yes, I just had a question, a follow-up to Mr. Morris's question, and then I did want to ask about reopenings as well.
Okay, you have.
Thank you, and I apologize for my technical difficulties. Is she still on the line?
Still there.
Yes.
Okay, good. You know, I appreciate, and I'm you know, somewhat conflicted on my opinion on the drop in testing. I mean, in some respects, that's good news because that means more people don't think they have a need to be tested. And then the Spock closing at the airport, in some ways also reflects that. But I recognize that folks do need to get tested. So just could you give us an idea of how we can, you know, who does need to get tested at this point? I know the governor put out a call to ask folks to come in if they, you know, were in large gatherings over Labor Day. You're telling me that that's not happening, or telling us that that's not happening. So can you just speak to that piece a little bit? Because it is confusing to the public.
Okay. Well, I think in general, you know, speaking as a public health person, actually, if I had my druthers, I would have a huge numbers of people coming in to get tested, because that's how we really get a handle on the number of true infections are out there, a number that are asymptomatic. However, that's not really possible. But I think that it's very clear to say that there are some very clear indications of people who should be getting tested. The most obvious is if you have symptoms, you should absolutely be getting tested. If you have any indication that you were around somebody who was infected, either because they're known to have tested positive or because you're suspicious of it, then you should go ahead and get a test. In addition to that, we have people who, through external circumstances, are required to get a test, either because of their school or employment requirements, and we encourage that. We're fine. Please do come and get a test. And as Commissioner Hausman has alluded to, the executive orders have asked that people who have any indication that they might have been in a position where they could have been exposed, like in a large group, around a number of people who were not masked. We really want people to, I'm not even going to say the word err on the side of, because I don't think this is an error. I think going in and getting tested is actually a very good thing. I would also encourage people who are around very vulnerable people. Like, for example, if you have a household member who is in a higher risk category, then I would love to see you come in and get tested, have a lower threshold for coming in and getting tested, that would help with, as you protect, to help you protect your loved ones. So my general feeling is that I'd rather see more people coming in getting tested who may not have classic symptoms and the like, because it's a good thing for us to get a better handle on the number of true cases that are out there and the number of asymptomatic cases that we have.
But you are not seeing an increase in testing since Labor Day per the governor's request.
No, we have not seen that yet. Our numbers as were presented have been pretty steady and much lower than our capacity. So I don't know if people, well, okay, let me say what's an indication we've got from across the country, including in a few places where they've actually done some surveys, is that unfortunately people are tired of COVID. They're tired of thinking of it. They're just basically, over it, sort of prematurely. So we do have an indication that maybe part of this thing about not coming in for testing is that people are just not coming in unless they actually have symptoms or are otherwise forced to, because they are kind of tired of this. But that's just an indication from other surveys. We have not actually looked at that here.
Okay, and so in the report, you indicated that we currently have 3 testing sites, one north, one in town, and one in the south. Is that correct?
Those are standing spots. We also have our mobile spots that go to various places around the county as needed.
Okay, because I did hear a media report about 2 additional sites. Would those have been the mobile sites?
I don't know which report they're talking about, so it could have been. And remember, we also work in conjunction with CORE, and they have additional mobile sites. So I believe we have 11 or 12 sites in total between our standing spots and our mobile spots and CORE.
Well, they mentioned Adamsville. Is that our site or City of Atlanta or CORE? Whose site is that?
Adamsville is ours, and we are in the process now with money that we have received to actually establish another spot site there. That would be a standing spot.
So that's in the City of Atlanta, correct?
I'm really bad at locations. It's one of the Fulton County sites. I'm not sure which city it's in.
Yes, Atlanta.
Okay.
That's what I thought. So I guess the reason I'm asking specifically about what we're doing in the City of Atlanta should be pretty obvious with this issue of funding and how we're allocating our resources. So anything that we're doing in Atlanta, is that being paid for by Atlanta?
Yes.
Okay,
good. Yeah.
All right. But I guess, if the feds left because of the demand issue, at some point we will react accordingly to the demand issue as well. Is that part of your planning for the future?
Reacting to the demand? You mean in terms of reducing our spot sites, or?
Well, I mean, if the demand isn't there, the resources should not be there either for no reason. I would hope that's what we're looking at.
Well, obviously, if we get down to the point when people are just not coming in, it becomes no longer cost effective to keep a certain spot site open, we would consolidate. But we do not feel that we're at that point now. Plus, we are gearing up, as I mentioned before, we're gearing up for flu season, which we anticipate will probably also have an increase in COVID cases. And we're going to be using our spots to get out flu vaccinations. So no, we're not at this point going to be reducing our spot capacity.
All right. Well, I'm just asking you to please be mindful of the limited resources that we have. Mm-hmm. And then Ms. Roach, in your opening plan, I didn't hear anything about libraries. What's the status of the libraries?
So if you recall, Commissioner Houseman, we started out with a Monday through Friday schedule for curbside service. We've extended not just the hours on curbside service, but the days, and also offer Saturday hours. At this juncture, we are not anticipating opening the library buildings to the public.
Can you just take a look at what our neighbors are doing currently? I'm continue to get a lot of requests from the public on when we are going to reopen, especially with the school issue and school being in and the needs that the parents have. So I would just ask that we take a look at what's happening in the region in-person library services so that we can make sure that we're providing what the community needs in a safe manner, of course, but I don't want us to be the last to reopen.
Well, Commissioner Houseman, I hear you, and we will take a look at what our neighbors are doing. We also take a look at our COVID results in Fulton in comparison to our neighbors as well. I think we have been more conservative than our neighbors in terms of our opening, and I think that our results in terms of the spread are speaking for that. So yes, I agree. We should be looking at our neighbors, but we will be looking at our neighbors in all aspects, and we'll be taking everything into consideration when we plan for our phase 2 reopening. Thank you for sharing that.
Other questions for Chief Operating Officer on reopening?
I have a question.
Commissioner Hall?
It's for Dr. Paxton.
Okay. Dr. Paxton?
Yes, I'm here.
Dr. Paxton, one of my team members went to go get a COVID test this morning, and it was completely different from what we usually see with the Q-tip going down the nasal passage. She actually had to have this Q-tip that went all the way down her throat through her mouth. And so has the procedure for testing changed?
No, I'm not aware of where was she? Where did she go?
In Sandy Springs, Kaiser Permanente in Sandy Springs.
Oh, okay. So she didn't go to one of our spots. Well, there are several different types of tests that are available. So it could very well be that Kaiser Permanente is using one of these different tests. The important thing is is collecting the specimen from as far back as one can get. And actually you can reach it through you can reach it through the mouth, I suppose, but it's better to go through the nose. So I can't comment any more than that because I'm not actually certain which particular test the Kaiser.
Okay. All right. Thank you. That's my only question.
All right. Other questions?
I had a quick question for Dr. Paxton, I believe.
Okay.
Great presentation, Anna. Wonderful presentation, very thorough. With the combination of the flu and this coronavirus, we talked about the peaks potentially in October. I don't know what we normally do during flu season in terms of our Board of Health normally without a pandemic, but I don't know if there's some kind of a way we can combine some things. Are there some things that we would have regularly done to prevent some of the flu? Obviously, we encourage flu shots, but I've seen, Georgia, the state has a COVID-19 hotline in terms of advice or whatever have you, but there are other outfits available, other companies. This one big national outfit is called Health Tap, and they have, they say, pretty high quality healthcare from doctors online 24/7 from any device, kind of an ask a doctor hotline. With the combination of the flu and COVID-19, it's going to be hard for some people to tell what's going on if they get a sniffle, if you follow me. And I thought something like that for the county would be great. I don't know if we're still with Kaiser, right?
I don't know. You mean in terms of what the employees are with? I think so.
Well, employees, yeah, but maybe somebody has something locally, or Wellstar or GenCare, or somebody has something along those lines that we could opt into in terms of a ask a doctor hotline to keep the hospitals from filling up. Again, someone gets a sniffle, they may just have a flu or a slight cold, or they may have the virus, and they don't know. So something along the lines of, look at this Health Tap thing and see how that thing is. I don't know if there's a fee for that, but I thought something to take us into these last few months through the holidays where people are going to be wondering what they have, if they have anything at all. And, getting a doctor on the phone or getting a registered nurse on the phone even on behalf of the county, I think would be a good plus if we could set up some kind of a service along those lines where they could call a healthcare professional with their question. So I think it'd be, I think it's worth taking a look at.
Okay,
So,
your suggestion's been noted, and I should have mentioned also that as part of our influenza campaign, we hope to be getting a lot of information to people, like, in terms, it is very difficult to distinguish in some cases whether or not what you're experiencing is COVID or whether it's not the reasonable flu, although there are some differences. And so we want to get that information out to people. But the most important thing we're going to have to get out to people is that if you're having these symptoms, you should probably just go get a test, because there's no really reliable way to tell whether or not something is COVID or if it's a cold just by symptoms. So our ultimate question is, our ultimate advice will be, please go get a test.
Absolutely. Absolutely. But sometimes just hearing from a medical professional, it pays dividends for a lot of folks just for worry on the mind in that sense. And I mean, we've got some doctors on staff or some health professionals on staff, perhaps. I don't know if there's something we could set up along those lines that somebody may be available to answer a question where someone can call a number from the county to get some guidance. So
thank you.
All right, other questions at this time? Not continue, Madam CO.
Chairman, at this time, I'll turn it over to the CFO for the CARES Act Fund update. Thank you.
Thank you, Ms. Whitmore, sorry.
Please and with.
Dr.
Good morning, Commissioner. Sharon Whitmore, Chief Financial Officer. Next slide, please. We do have a brief update today on our CARES Fund. Not a lot has changed since the last presentation. We are still showing a full commitment of our $104 million that were received under the CARES Act. We have now paid $37.6 million of that 104 for various goods and services received in response to the pandemic. Next slide, please. This slide shows you that from the previous reporting period, which was as of August 28th, presented on September 2nd at the board meeting, we have not made any changes to the allocations, community related health response, operational stability, or municipal reserve, and the fund remains fully committed. Next slide, please. This slide is the details of the current purchase orders that are outstanding through the September 11th would be the cutoff date for these purchase orders. We have 35.3 million in open purchase orders, of which we have expended 9.8 million in total since we began use of the CARES funds and reporting to you. We have issued a total of 41 million in purchase orders and have completely paid out and closed 5.7 of that. That's how we get to having the open PO amount right now of 35.3. Next slide, please. This slide is the summary of our other placeholders, commitments, and other payments that were made for items that were not purchase order related. On the left-hand side of the screen, you can see that our current placeholder amount is 17.7. The majority of the funds associated with the placeholder are remaining in the funds that were set aside for PPE, as well as funding the Fulton County's portion of the Board of Health's testing program. And we have 8.3 million still set aside for that. Down below that in the commitment section, we have a total of 23.2 million that's committed. The largest component of that is the Municipal Relief Fund, which currently has a committed amount of 13.7 We began at 2.5, we increased it to 15. We've now made some payments against that 15. And so the balance that remains is that 13.7. The other large item, the other two large items in the commitment section is the community relief, the balance of what has yet to be paid in our community relief program. And that's 2.7 million. Of that amount, the largest component that has yet to be paid, I believe, is the 1.5 million that was set aside for the small business or the grant loan program for the artists. And then the next item down, next largest item down is the contract with CORE. It is showing as a commitment, and we actually finally got the purchase order issued. We had some hiccups getting the vendor code established, which is what delayed the actual physical issuance of the purchase order, but that has now been done. So in the next report, you'll see that move over to the purchase orders listing. So again, that's 23.2 million in commitments. On the right-hand side, for disbursements other than against a purchase order, we have a total of 21.9 million. The largest component of that relates to the payments that we've made against our community relief package, totaling 13.3 million, followed by our hazard pay that we made through to employees through the middle of June at 4.6 million. And down at the very bottom of that section, you'll see the municipal reimbursement payment through last Friday of 1.2 million. So we've made, when you take that 21.9 and you add it to the amount identified as payments against purchase orders from the previous slide, that's how you arrive at the 37.6 million. Next slide, please. This is the update slide for the community relief package itself. And you can see how from our phase 1 and phase 2 community relief packages, how the funds were allocated and committed, and the amount that has been paid out against each of those phases and categories. Next slide, please. And the last slide that we have for you today in the CARES Fund update is a look at the municipal reimbursement program. The view that we're showing you today is for the full 15 million that's currently been allocated to the municipal relief program. And the allocation basis here is by population. And in column A, what we've identified as first request, that's the what was originally submitted for reimbursement against the 2.5 that was originally set aside for this program. So they originally asked for a total of 1.8 million. We received a second round of reimbursement requests the first week of September. That amount totaled 21.3 million. So combined, we have a total request from the municipalities of 23.1 million. And the amount that we have paid against the documentation and support we have received thus far has been 1.2 million. So we've identified the amount paid by city as well. And with that, I will take any questions that you have on the CARES Fund.
Are any questions at this time? And remember, we will be talking about some of this a little bit more detail in the executive session, but any questions, general questions at this time? Any questions? If not, thank you very much, Madam COO. Strike that, Madam CFO.
Thank you, Mr. Chair.
Anything else to add, Madam COO, Mr. Manager?
No, sir.
Okay, Mr. Shapiro, Dr. Shapiro from London is on the line now. So as I indicated earlier, I'd like to take that up since he is available now. It's late afternoon in London. And Al Nash is also on the line to talk about the sound diplomacy study. Also on the line to talk about the sound diplomacy study. You? Okay, I think we're okay now. So we're going to take up the sound diplomacy matter now, as I indicated earlier. Dr. Shapiro, are you with us?
Yes, sure, if you can see or hear me.
We can. Thank you very much. Dr. Shane Shapiro is the CEO of Sound Diplomacy. He is on the line in London, England. Sound Diplomacy is the organization that conducted the study. You will recall that in July of last year, the board unanimously approved our contribution, $250,000, to match what the state of Georgia had put in for this study. The city of Atlanta was not involved from a financial point of view. So this is an effort between the state of Georgia and Fulton County. We have long believed that we are a capital center for the entertainment industry, music in particular. We believe that, the world has believed that, but there was no real proof or documentation. So as a result of this study of what we have believed to be the case and what we have thought to be the case, we now have proof, we now have documentation that we are as good as we say we are and have believed that we are. So with that in mind, I would like to ask Dr. Shapiro to summarize the findings of the study briefly for us. Each of you should also have received a copy of the study, and it will be released to the public after our meeting today. So if you get any calls, you will be knowledgeable about it. But as of this moment, it is not a public document, but after this discussion, it will be a public document. So Dr. Shapiro, thank you very much for joining us this morning.
Thank you very much. I wish I could be in Fulton County with you. I'm a big fan of Fulton County and Atlanta in general. So very briefly to outline, first I have to stress the work began pre-COVID. And really it was, as you stated, really trying to understand and quantify the value of the wider music economy and ecosystem in Fulton County. So we can, do, as we say, do better with what we have. So first off is that Fulton County's music economy is among the top 10 in the entire United States. And per capita, you have more music output than New York and Seattle. So that's very important. And the direct employment in the music ecosystem grew by 110% in the last 2 decades, which represents 6 times the growth of the employment of the rest of the economy in that period. And Fulton County is responsible for 34% of the entire music ecosystem in the state of Georgia, which again is a lot. So as you said, we believe that we have proven what you believe to be true is true. And we also recognize that because of the challenges related to COVID, that certainly has changed how we approach the recommendations in the work and what we want to do from here. And really the purpose of the work now is, and the recommendations are to prioritize what can be done from a policy perspective and from as much of a cost neutral perspective as possible to ensure that Fulton County doesn't lose this leadership that you have. Because the thing is the music economy, it remains in growth. Even during the pandemic, the music industry has grown. More of us are listening to music than ever before. So there's a terrific opportunity to seize what you have, because a lot of other places will take it if we don't. And a few of the initiatives that we're hoping to take forward from these findings really include, working with partners at the state and with Georgia Music Partners to modify the Georgia Music Investment Tax Relief to continue to spur investment in music, and to do further regulatory reforms within Fulton County, especially in building a more proactive regulatory atmosphere around recording studios, because there are a lot of informal recording studios that we believe can add even more value to the economy now if they were recognized and formalized. But those are the key points. Obviously, we have an executive summary that we have submitted, which have all the economic data, as well as the methodology that we took in this work. But for the one takeaway is, oh, that's my timer. I timed myself for 3 minutes. So the one takeaway is that there's an incredible resource, regardless of COVID, in Fulton County right now. It is far greater than even we thought it was. So this is a fantastic tool to, as we say, build back better, and also to recognize that more and more people are listening to music than ever before. So there's great competitive advantage that we don't want Fulton County to lose. And we hope that the recommendations and the data in this study help further that along as we move into recovery.
All right, thank you very much. Al, Mr. Nash, would you like to add anything briefly?
Well, I'd like to tell everyone good morning, and Shane, thank you for coming and speaking to us. I would like to point out one thing that the chairman mentioned. I want to clarify that the 250 that we matched, that you matched with the state, was part of the bigger picture of helping to try to secure the Grammy Museum, which y'all are all aware that the announcement was made that the Georgia Music Accord now has the right part, and it will be built in Fulton County. It's certainly, it's a long path. We got to go raise a lot of money, but I want to be clear that the 250 was not the cost of this study. It was just a small portion of it, but as a byproduct, it really helped to solidify that the need and the win of the deal. One thing Shane did not mention, I think, is you'll read in the study, is the fact that we are now probably the best place in the or one of the best places in the world to create a music career or start a business. And we see this as a great way of possibly building off of it. And I would remind you too that with all the entertainment productions and so forth, if you read what's happening right now, a lot of the production that is occurring to fill the content that on all these streaming and TV and so forth is being done here in Georgia and being done primarily in Fulton County. And so the other piece would be the gaming, and that's not gambling, but gaming is really starting to grow, which has a music component to it. So there's a lot of tentacles that go out of this. And as Chairman said, we now have evidence and proof that we are a leader, and the future is really bright. And certainly we have to maneuver around COVID-19, but I think we're well set for the future.
All right. Thank you, Mr. Nash, and thank you for clarifying my my remarks. Commissioners, any questions at this time? Any questions?
Had a couple. Thank you for reaching out to us from across the pond there. You know, Atlanta and Georgia in general, big music industry area. Just converting this to our young people, to our millennials, in terms of all of the plethora of jobs and services and you know, ancillary services for the music industry, for the movie industry. You know, I grew up in the music industry. You know, in another life, I did some songwriting back in the 90s here in Atlanta when LaFace Records was here, and of course grew up from a kid. You know, my mother was in the music business, and my cousin Peebo Bryson was a singer in Atlanta for ages, and so it's good to see that it's still going strong in Atlanta. But how can we convert it to getting the word out in terms of to our high schools, to our local folks, to folks that are looking to transition into something else? Obviously, the jobs are plentiful in the movie and entertainment business in Metro Atlanta, but how can people find out about it? How can we get the word out? You know, external affairs can only do so much, and right now they're pretty much overloaded between pandemic, census, and elections, and God knows what else we're throwing at them. So, Al, I guess getting a sensible outlet to get the word out on a broader base. I guess that's the question. How do we get the word out to tens of thousands of folks that may be looking for a new career?
to respond on our side, I think our partners locally, Georgia Music Partners, obviously the connection as well with the local representation of the Recording Academy. They were all key partners in this work. We also interviewed quite a few people in this, and I think the one opportunity that we can do now that the study is published and working with Georgia Music Partners is to go back to the network of professionals that we interviewed and that we worked with throughout this process, and get them to share it. In addition, we think that having music play no pun intended, a key role in the economic development strategy and workforce development strategy in as direct and intentional a way as possible moving forward, that music is mentioned as much as possible because it is such a leading sector, will help that as well. And we're hoping now that we have the data to galvanize the community to understand how valuable this is across the county.
Mr. Nash, you want to add anything quickly?
Yeah, real quickly, I think that certainly our partners at APS and at the Fulton County Schools are real partners. I think now that we have a study that we can build off of, it's going to be critical. And then we can reach out to our other partners at the Metro Chamber and chambers across this, and really in the industry to really build this. But talent is a very critical part if we're going to grow the ecosystem further. So your point's very well taken, Commissioner.
Is there a board for this of some type in Metro Atlanta that we're going under, or?
There is a board, Georgia Music Accord. The chairman, I think, serves on that board, and that board will, of course, be expanded as we go. I can tell you that the one thing, the Grammy Museum will be a very driving force, will be education. That's a huge component of that. So there's more to come, but it's going to take a lot of folks to come together, and certainly we'll reach out as we move forward.
Okay, and Al, you mentioned the Music Accords board. Do we have a permanent representative on that board for the county? And I ask if you could find out about the makeup of that board. I'd like to know, how many African Americans you have on that board, stuff like that, because I'm not familiar with the board at all.
I'll yield to Chairman Pitts to address that if he could.
I will send him a copy of the makeup of the board. Absolutely.
Okay. Thank you.
Okay. Other questions at this?
Mr. Chairman.
Commissioner Morris?
Just very quickly, I'm wondering if the Fulton County Arts Council might have a little bit of a role in this. They don't just do the visual arts, they do the performing arts as well. So maybe Commissioner Carn, they can have a role in getting the word out as well.
All right, good point. Thank you, Commissioner Morris.
Mr. Chair, I'd also like to get a copy of that report. And I'm not sure, I hope you guys have looked at what T.I. has done with his trap museum. It's packed every weekend. 200-300 people inside and 200-300 people waiting outside. So I'm confident if he can do that, that the Grammys can do something even better.
Dr. Shapiro?
Yes, the Trap Museum is one of our kind of core case studies in the report as proof of concept. And we have liaised with the Arts Council throughout the work. I believe they have received it. I'll make sure from my side as well that the Arts Council gets a copy of the report. They're in it as one of our delivery partners moving forward.
Anyone else at this time? If not, thank you so much, Dr. Shapiro, and Mr. Nash, thank you very much.
Thank you, everyone. It's a great honor. It really is. Thank you.
Right. Madam Clerk, continue, please.
Okay, back on page 6, 20-0644, Finance, Presentation, Review, and Approval of the September 16th, 2020 Budget Soundings.
All right, entertain a motion. All right, I'll move approval. Is there a second?
Second.
Properly moved and seconded. Let's vote, please. Commissioner Houseman,
She was having trouble.
Commissioner Ellis,
Hold on.
Yes.
Commissioner Houseman was having trouble
okay.
unmuting.
Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Commissioner Arrington, Commissioner Carn,
I vote yes.
and I vote yes.
And the motion passes.
Continue, please.
20-0645, real estate and asset management, request approval to renew an existing contract to provide bus and shuttle services for Fulton County employees and jurors.
Is there a motion?
Motion.
All right, is there a second?
Second.
Second.
Properly moved and seconded. Any questions or comments? If not, cast your vote, please. Commissioner Houseman? She's still having trouble.
I think so.
All right, Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Commissioner Carn,
Yes.
and I vote yes.
And the motion passes 6 yeas, 0 nays.
Will y'all check in with Commissioner Houseman to see what's going on? All right, continue, Madam Clerk.
20-0646, real estate and asset management, request approval to renew an existing contract to provide post-closure care services at 2 municipal solid waste landfills.
Move approval.
Move approval.
All right, properly moved and seconded. Let's vote. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Commissioner Carn,
Yes.
and I vote yes.
And the motion passes unanimously.
Continue, Madam Clerk.
On page 7, 20-0647, real estate and asset management, request approval to increase spending authority to provide additional standby fencing installation and repair services.
Move
Is
approval.
All right, is there a second?
Second.
Second.
Properly moved and seconded. Cast your votes, please. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Morris,
Yes.
Hall,
Yes.
Arrington,
Yes.
Carn,
Yes.
and I vote yes. Continue, Madam
And the
Clerk.
motion passes unanimously. 20-0648, real estate and asset management, request approval to renew existing contracts to provide fire sprinkler protection system maintenance services.
Move approval.
Move approval.
All right, properly moved and second. Let's vote, please. Commissioner Houseman, Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Commissioner Carn,
Yes.
and I vote yes.
And the motion passes 6 yeas, 0 nays. Under Justice and Safety, 20-0649, Sheriff, request approval to renew an existing contract to provide national prisoner transportation services.
Entertain a motion to approve.
I had some discussion and some issues
I have
on
a
this.
question.
Okay, Commissioner, all right, Commissioner Carn, followed by Commissioner Hall.
Looking at this, and I've spoken briefly with Alton about this. One of the things I don't want to do, obviously, we've had quite a bit of political activity in terms of our Justice Department. Major changes coming for next year, obviously, between the DA's office, a lot of our judges, probate, sheriff's office, you name it. I don't want to tie anyone down that's coming in next year with a contract necessarily that does not have to absolutely be renewed necessarily. I always want to give, folks the indifference in terms of their options, or just give them that courtesy if we can, if they may want to have another look at things coming in, as opposed to being tied into something that we're approving or have to approve, or if we don't have to approve this yet. So I want to see if there's some type of a way we could, hold up on this, and I'm assuming our services go until the end of the year, of course. Does anybody?
Yes, Commissioner, this is Alton. I'm on the phone here. As we discussed yesterday, and I had a conversation with Flora from the Ms. Eatman from the Sheriff's Office. The contract is due to expire at the end of this year, and I think part of your question to me was, could we potentially go month to month to allow the flexibility to potentially put another bid out. And I did talk to her about it. Obviously, we would have to talk to the provider. They would have to agree to that, and then we'd have to figure out what the price would be. But we do need services. Obviously, we couldn't have a gap in services because we do transport individuals, and we do have a requirement for these services. So we could certainly, and I'd have to go back and talk with Ms. Eatman and Colonel Graham. We could certainly explore the potential of going month to month to allow the flexibility that you're talking about. But obviously, we would be challenged if we were to let it expire totally.
Understood. Well, I'd like to take a look at that and see if we could get an answer on that before we commit to anything that we may or may not have to commit to at this point. So that's all I had on that. But I think about it.
Yes, I have a question about, has the Sheriff's Department seen COVID-19 impact their out-of-state inmate transportation to date?
There has been some, as you are aware, Commissioner, a number of correctional facilities basically put on hold admittances to their facilities in the height of COVID. That transport has in fact resumed, both outside of the state as well as inside the state. I think we're on track to transport somewhere in the neighborhood. I think to date we've transported somewhere around 170 individuals. So yes, there was a pause, but that transport has resumed on a I wouldn't say 100%, but it certainly has resumed in terms of facilities both in the state and out of the state, accepting transfers from the county.
But what kind of impact has it had due to social distancing? Because I'm sure you just can't pack them into the vehicle like we used to do before COVID-19.
Well, I'm not sure we pack them in. Typically, these are individuals that are transported one or two at a time. There's usually no there's no grouping of large numbers, at least not that I'm aware of. So, but I will also say that certainly in terms of our own transport, and I can't speak to this particular vendor, but certainly in terms of our own transport, we have in fact made accommodations and make sure that we practice social distancing and the appropriate use of PPE and so on. So I can come back to you with the protocol that this particular transport company is in fact using. But this is not a situation where they typically will transport large numbers of individuals from Fulton County or to Fulton County.
Okay, and have they projected what the impact will be through the next year?
Well, I think like all of us, we're not sure, right? Because part of this will depend on our ability to move individuals through the system, i.e. the resumption of jury trials. Part of it will be what's happening with COVID overall and how that impacts the decisions with the various correctional facilities in terms of kind of reopening totally again. Part of it is just going to be based on the entire volume of individuals going through the system. So I think it's fair to say that the ability to project that is probably as good as our ability to project anything at this point in time, based on the uncertainty that's driven by COVID and our ability to ramp up the system once we have the ability to do jury trials.
All right, thank you so much, Alton.
Any other questions or comments?
I have one, Chairman.
Go ahead.
Commissioner Morris?
To follow up Commissioner Carn's concerns, I guess this is to the county attorney or to Ms. Strong-Whitaker if she's on the line. If we were to renew this for next year, because again, the service is needed and we're going to have it on January 1st, potentially January 2nd, if they need a prisoner moved from Ohio to hear from a witness or whatever. Can this, if we renew this for next year, can we not terminate it at some point for convenience or otherwise and accomplish what Commissioner Carn's concerns are and still go ahead and get this contract renewal in place.
Yes, Commissioner Morris, you do have the ability in all of our contracts to terminate at the discretion of the board with notice, a certain period of notice, but generally this is routine regardless of people taking office, that the existing contracts have been in place. You generally have to renew them 90 days in advance of their date of termination. So a lot of them will be coming through now, and it's not a political thing with the new incumbent coming in. It's more a function stuff with regard to like transport, food, etc. So in this case, if there is a cause for the person to the entity to be canceled, or for example, the Commissioner Hall's questions, we don't have the need to do that as much because of the situation with COVID. We have the flexibility to terminate this contract.
Well, I'd like to go ahead and move approval, Mr. Chairman, based upon that.
All right, and Commissioner Carr, you still have the floor.
I had a bit of discussion, and Commissioner Morris,
just a minute.
I thought Commissioner Carn did a substitute motion to hold, or did I not hear that correctly?
Well, I was going to.
Just a minute. Commissioner Carn has the floor. He's not made a motion yet, and Commissioner and Vice Chair Arrington is in the queue. Commissioner Carn, you still have the floor.
Commissioner Morris, I understand where you're coming from. We have to have the service. My suggestion was going to be, as a substitute motion, that we at least hold it today, find out if we can possibly, if go in month to month, let's say the first couple of months of the year for this thing, so we still have the service. But I wouldn't want to lock anyone into any situation, as we have some things changing and some changes in policy possibly over there, where they're locked into a situation that they may not prefer to be, or they would like to have another look at.
Okay.
So if we could hold today, find out if we can go month to month, which most of the contracts I've seen over the years that there's a month to month option. It may be a tad bit more expensive, but I think it may be worth it just in terms of giving a courtesy to the changes that we have coming in Fulton County, from the DA level to the sheriff's level, you name it. I think that might be a wise thing to just pause for a moment and bring it back at the next meeting if possible. That would be my substitute. If you're amenable to that, I would hope we'd be amenable to that.
All right, substitute motion is to hold. Is there a second?
Second.
All right, properly moved and seconded. Let's vote.
There's discussion on that motion, Mr. Chairman.
Sir, yes, sir. Mr. Moore.
County attorney referenced that some contracts require a 90-day advance notice before expiration. I'm wondering if this one does, because to hold it would get us past that 90-day. Do we know?
I don't have the actual contract in front of me. Felicia Strong-Whitaker, I see you're on. Do you know if it has 90 days or 30 days?
It does not. All of our contracts have a termination for convenience, which is usually 30 days, 30-day notice. The 90-day is the board policy that all contracts have to be renewed 90 days before they expire.
Okay.
If I can, one other point of information, Commissioner Carn, per our discussion yesterday, this particular vendor is one of the few, not to the extent that it makes a difference, but this is one of the few nationally that does provide national services, and they also were the only bidder the last time we sent out an RFP. And so when we talk about holding it, it would require us to hold it for a couple of months and then issue another RFP. So we really would be talking about holding this for probably doing a month to month for 5 to 6 months.
Why would we have to hold it for 2 months?
We wouldn't. That wasn't.
Let me explain. What I'm saying is, when we have the change and the sheriff comes in, and let's assume we decided to go month to month, if he decided to change vendors, then we would issue an RFP, and then that process typically takes 1 to 2 months to get the responses and make a new decision. The only point I'm making is that if we talk about going month to month, it's likely a 3 to 4 month, perhaps 5 months, not just one. That's the only point I was trying to make.
Well, I'm speaking on month to month temporarily, but nothing about an RFP whatsoever. But just holding it to see if we can go month to month and bring it back at the next meeting.
Wants to hold the matter.
All right, the motion before us is to hold. Let's vote. We were doing great till we got to this one. Commissioner Houseman on the motion to hold.
No.
No. All right, Commissioner Ellis,
No.
Commissioner Morris,
No.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Commissioner Carn,
Yes.
and I vote no.
And the motion to hold fails.
All right, there was a motion to approve, which I'll second. Let's vote, please. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall, Vice Chair Arrington,
No.
Commissioner Carn,
No.
and I vote yes.
And the motion passes, 4 yeas,
No.
Commissioner Hall voted no.
4 yeas, 3 nays.
Continue, Madam Clerk.
Bottom of page 7, 20-0564, Arts and Culture, request approval of a resolution establishing the Fulton County Poet Laureate and naming of the inaugural Fulton County Poet Laureate, Dr. Karen J. Head.
What's your pleasure?
I'll move approval, Mr. Chairman.
All right, the motion is to approve. Is there a second?
Second.
All right, properly moved and seconded. Any questions or comments? All right, cast your vote, Madam Clerk.
And the vote is open.
Commissioner Houseman, Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Commissioner Carn,
Yes.
and I vote yes.
And the motion passes, 6 yeas, 0 nays. On page 8,
Yeah.
20-0650, Community Development, request approval of a statewide contract to provide temporary staffing services for the Department of Community Development.
Mr. Chairman.
Yes.
I noticed in the document that it recited the holidays the county observes. And based upon the action we took not too long ago, those holidays aren't correct. We could get that fixed if we need to in the scope of services.
Good catch.
Can be done administratively.
Yes, we can do that administratively. Thank you, Commissioner Morris, for that observation.
Certainly. I'll move approval with that change, Mr. Chairman.
Okay.
Second.
I'll second. Commissioner Carn, do you have a question or a comment?
No, I was seconding.
Oh, okay. Record Commissioner Carn is seconding the motion. All right, let's cast your vote, please. Commissioner Houseman, Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington, Commissioner Carn,
Yes.
and I vote yes.
And the motion passes, 5 yeas, 0 nays.
Continue.
20-0651, discussion and Invest Atlanta Board of Directors, August 20th, 2020 meeting summary, sponsored by Commissioner Morris.
Commissioner Morris?
Yes, this is simply the summary of the minutes of the actions taken at the Invest Atlanta August 20th board meeting. You review that and want any information about any of those projects or actions that were taken, be delighted to get them for you.
Okay, any questions or for Commissioner Morris? Continue, Madam Clerk.
No further items, Mr.
Yeah,
Chairman.
there had some add-ons.
We certainly did.
Yeah, four add-ons.
Call them all together.
Are we taking them all together?
Yes, let's sound them all together. Then you're going to speak to it, Mr. Manager, or Ms. Corbett, or who?
I think Ms. Corbett is.
Ms. Corbett, you with us? Sound.
Okay.
These are the 4 add-on items regarding elections.
20-0657, request approval of a contract with Radio 1 to provide radio and digital advertising to educate voters about the November 3rd, 2020 general election. 20-0658, request approval of a contract with Cox Radio to provide radio and digital advertisement to educate voters. 20-0659, request approval of a contract with Intercom Communications Corporation to provide radio and digital advertising to educate and inform voters. And 20-0660, request approval of a contract with Outfront Media to provide radio and digital advertising to promote voting options.
All right, these are all self-explanatory, but Ms. Corbett, you with us?
Yes, sir. Good afternoon, commissioners. We have been working very closely with the Department of Registration and Elections to prepare for a major voter education and information campaign leading up to the November 3rd general election. Essentially, we are working to strongly encourage voters to utilize absentee ballot or voting by mail or early voting options to help us manage the flow and volume of voters on election day. By spreading out voting among the 30 early voting locations over a 3-week period, and also encouraging voting by mail as a safe and secure option, we will be able to manage the number of voters who are at the polls on November 3rd. We want to ensure a positive voting experience. And after some of the challenges that we've faced this year in voting, we want to ensure that voters feel confident in the process. And so providing them accurate, timely information, and again, reaching mass audiences, as you would see with these 4 agreements, we would be able to do that. So I appreciate your support.
I'll entertain a motion.
It's in order, Mr. Chairman. I'll move approval on all 4 items together.
All right.
Second.
I'll second. I had a little bit of discussion.
All right, Commissioner
I have a
Carr,
question as well.
Commissioner Carr, and Commissioner Housewood.
Thank you. Jessica, I'm glad to see we're doing this. Obviously goes without saying. I am seriously concerned about our upcoming election, and I want it to go as advertised. We put a substantial amount of additional monies into this election. And again, I guess I worry more about, if we're going to be getting this message out in our community. We want to make sure it's registering with our communities. We want to avoid the mistakes of the past where we don't want it to get political in terms of political celebrities coming in with this thing and throwing out the mix. We want to, like you said, we want voters to feel confident in this election in November. And I think as commissioners, all of us, we know our residents better than anybody. So I want us to be hands-on with this and make sure when we're putting out the message that the message is digestible to everyone, where we're sending it, to which genres of radio stations, news and print, whether or not this is a message for Ambassador Young, or if this is a message for Killer Mike, or if this is a message for Dottie Peoples to send, or whatever have you, to make sure we pinpoint that message to everyone we're trying to reach in terms of getting the understanding and the need to participate. So I just, and I know you have your shop and you have it well in hand, but I'm concerned that the message is on target. I'm concerned that that message reaches our people that we want to reach countywide, north and south, white, black, young, and old. So I want to make sure we have some detail as we go along to this thing to make sure it's effective enough where it resonates with our constituents. So they're hearing us loud and clear, and they're not afraid to come and vote, and they're not worried about 5-hour line waits. So I just want to put that out there. I support all of it, but I'm still worried. I just put it there. And I want to, I don't want to micromanage, but I want to know what's going on and how we're sending those messages out. But that's just me. So that's all I got on that.
Yes, thank you, Mr. Chairman. I apologize. My internet must be going in and out, so I'm glad you can hear me at the moment. Is this grant funded, or is this general fund funded, or COVID relief funded?
Good afternoon, Commissioner Hausman. This is general fund dollars. You may recall that at the last Board of Commissioners meeting, there was a budget soundings item combined with a grant receipt of a very large grant that the department received. And that item allowed them to shift some other funding to grant items that would allow this to be accommodated through their general fund budget. So essentially, this was not necessarily originally in their budget, but because they received this very large grant, they were able to accommodate this. And again, as we always knew that this was a very important election year, but after what transpired in June and some of the challenges we faced, we recognized that voter outreach, information, and education was even more important than we originally anticipated. 2020 has been a year full of challenges, and we want to make sure information is readily available to our voters.
No doubt. I fully support getting the information out. I'm just trying to determine where the funding source originates.
Yes, ma'am.
And I believe that in the grant application, there was some communications type areas in that grant. What is that going to be used for?
In addition to this advertising, we are working with the department to prepare a direct mail piece that will highlight all of the early voting locations, absentee by mail information. And I hope at your next meeting, we will be able to share with you, and actually before that, the new Fulton Votes app, which is another tool that we will have in place to inform voters. So this direct mail piece, which is another part of the marketing campaign, that was covered through the grant, and that is one of the things that we will be working on.
Okay, and did we ask or even try and see if any of our media friends would consider this public service announcements, which are generally done at no charge to the county?
Commissioner, I think that we have had a lot of discussion with media, and we have, there are several campaigns I think that the different stations are doing, and as I'm sure the board is aware, the Secretary of State is doing some work around their general efforts. Our target is very specifically around early voting, our early voting efforts, as well as, of course, absentee ballots. Commissioner, frankly, I don't feel confident that we would get the level of coverage that we need to really affect change and drive voter behavior to choose those options. In previous elections, we've had up to 60% of Fulton County voters choose early voting. We'd like to see that even higher for this election to just ensure that folks are taking advantage of that option, encouraging social distancing. I think the convergence with flu season, there's just a myriad of issues that we're facing. And I think this was our thought, was to get the level of coverage we needed to make an investment.
Okay, so I'll take that answer as a no, unless you're going to tell me differently.
I wouldn't say that we haven't had the conversation, but we did not feel confident that we would get the volume that we need.
All right, and just as a side note, I know we've got a confusing situation at the moment with an early or special election to replace the Congressional District 5. So the early voting locations are publicized on our website for that election. However, I've had many inquiries from folks trying to find out where the early voting sites will be for November. I know it's confusing, but is there any way that we could have both available for folks on our website separately?
Yes. Commissioner, I think that's a very good point. Those, as you know, those locations were approved on Monday, and yes, we will make sure that we have those up there today. And you're right, it is confusing for voters. Along those lines, I just wanted to mention that one of the other very important messages for Fulton County voters is the number for people who do choose to go to the polls on November 3rd. there's a very high likelihood that their election day location has changed. The Board of Registration and Elections has added many new voting locations for election day. This is another part of our public information campaign that, you know, if you choose to go on election day, you need to check your location. They're sending out mailers, they're sending notices, but it's critically important that people know that because of all the new locations, many thousands of people will have a new location for November 3rd if they choose that option.
Thank you.
Chair, I had one other thing, real brief. Since we're on the elections, the new polling changes, I would like to see that by city and make sure that we get that out to our mayors by city so that they know the city of Milton, here are your new polling changes, and get that directly to them so that they understand that for November. Additionally, one of the things my office has talked about, and I spoke to someone with elections, we need a November, this season, a short, simple voting guide on one page with the dates of the elections, the offices, the 3 ways to vote, and your deadlines. Now, all of this information is available between our Fulton County website and our elections website. But to have to hunt down that information, my thought, Jessica, was a simple 1-pager. Here's what's going on with the elections. I hear there are 2 congressional races in the 5th district. I hear there are 2 Senate races. What's going on? A simplified 1-pager with everything on it, dates to vote, a guideline, what offices are on the ballot, not who's on the ballot, but what offices, the 3 ways to vote, and the deadlines. Simple on 1 page where a high schooler could understand it. And we don't have that anywhere. So I think it'd be great to get something together like that so people have a clear understanding of what's going on this election season.
Okay, thank you very much. Anything else at this point? The motion is to approve?
Yes.
All right, let's vote, please. Commissioner Houseman? Commissioner Ellis? Commissioner Morris?
Yes.
Commissioner Hall?
Yes.
Vice Chair Arrington?
Yes.
Commissioner Carn?
I vote yes.
And I vote yes.
And the motion passes, 5
Thank you.
yeas, 0 nays.
Okay. Thank you, everyone, for your cooperation this morning. We're doing great. I now need to entertain a motion for executive lunch and exec recess for lunch and executive session for real estate litigation and personnel.
I will so move, Mr.
All
Chairman.
right, I'll second. Let's vote, please. Commissioner Houseman, Commissioner Ellis, Commissioner Morris.
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Commissioner Carn,
Yes.
and I vote yes.
And the motion passes.
I vote
Okay.
yes. I'm having internet problems. I
Okay,
apologize.
thank you, Commissioner Houseman. Now everyone has received that motion is approved. So we
Yes.
have lunch and then followed by executive session.
Yeah.
You have a special number to call, everybody
I
has
have
a
the
number?
yes.
Okay,
When would you like us to call that in, Mr. Chairman?
so can we, well,
We can.
20 minutes, if that would make it, what, 1:45?
Yeah.
At 12:45? 12:45.
Great.
All right, thank you everyone for your cooperation this morning, I really appreciate it. Now, all of this is off now, right?
Hold on.
really struggling over here. You're not getting half my text messages. They're grayed out when I go back to look, and I've lost the internet connection multiple times. I know that's not your fault, but it's windy as hell here, so I don't know what's going on. That being said, do I have the number to call into executive session?
Commissioner Hall, can you hear us now? Commissioner Hall is on.
Can you make sure we're all on, please, sir?
So what we don't want to do is unmute this room, because if you unmute this room, you're broadcasting again.
Well, then you fix it, whatever you need to do.
Hear you.
John?
Lee, can you hear me?
I can.
Okay, good. Because it's just, I don't know what's going on. I've got a demon in my house today.
It's much clearer now.
That's so crazy.
I mean, the last time we were on, we could hear you, but it was quieter than.
You know, maybe I had too many devices on at the same time. I
Yeah.
don't know. I don't know. I do have 3 computers going. Well, I've got Sire over here, and then I've got, you know.
Yeah. Yeah. Now me, I got my laptop here at home and looking at things on my phone.
Well, I just didn't want to print off all those documents.
I didn't either. It's tough going back and forth though.
Yeah. I broke a fingernail over it today.
I'm so
Tragic.
sorry. I'm so sorry. Happy birthday, by the way, Anna. A little late.
Horace. There we go. Thank you so much, Commissioner.
Yeah, you don't look too much older.
No, 30's been rough. They tell me when I get to 30, it'll start feeling it. So I think I'm starting to feel it.
Yeah, I can't wait
One
till
thing
I'm
about
30.
wearing a mask, we all look the same age.
That's right.
You okay now? We ready?
Yeah.
All right, I'll entertain a motion without objection to resume the regular order of business. Madam County Attorney, item from executive session.
Yes, sir.
Is everyone with us, Madam Clerk?
Looks like we have Commissioner Morris, Houseman, Anderson, Ellis, Carn is here. Yes. Where's Commissioner Hall?
Commissioner Hall, you with us?
Yes, I am.
Okay, thank you. All right. Madam County Attorney.
Yes, sir. I would like to have a motion to deny the request for representation discussed in item number 2 during executive session.
So moved.
Motion to deny. Is there a second? I'll second. All right. Commissioner Houseman,
Yes.
Ellis,
Yes.
Morris,
Yes.
Hall,
Yes.
Arrington, Carn,
Yes.
and I vote yes.
And the motion passes 6 yeas, 0 nays.
I would like to have a motion to authorize the settlement discussed in executive session during topic number 3.
Motion, please.
Motion.
All right, motion to approve by Commissioner Carn, and I will second. Let's vote. Commissioner Houseman,
Is this item number 2?
Item number 3.
3.
No.
Commissioner Ellis,
No.
Commissioner Morris,
No.
Commissioner Hall, Commissioner Arrington,
Yes.
Commissioner Hall, yes. All right, Commissioner Arrington,
Which item was this?
Item number 3.
Oh, yes.
Commissioner Carn,
Yes.
and I vote yes.
And the motion to approve passes 4 yeas, 3 nays.
I'd like to have a motion to authorize the chairman to execute a settlement agreement reached in the matter of Eliza Lassiter versus Fulton County et al. In USDC, Northern District of Georgia, case number 18-CV-20311 for $70,000.
Madam County Attorney, the number you read, the 5-digit number there was not the number on the agenda. You transposed to when you, I think you said 203.
All right, thank you very much, Commissioner Morris. Just for correction purposes, it's 1:18-CV-02311.
That's it.
Okay.
I'll move approval.
All right, I'll second. Let's vote, please. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington,
Yes.
Mr. Carnes? Yes. And I vote yes.
Motion passes unanimously.
I'd like to have a motion to authorize the chairman to execute a settlement agreement reached between Zurich Labs and Fulton County with regards to the N95 mask.
Move approval.
Second. All right, properly moved and seconded. Vote please. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall, Vice Chair Arrington,
Yes.
Mr. Carnes. Yes. And I vote yes.
And the motion passes unanimously.
Under item number 6, I'd like a motion for, well, never mind, don't need a motion on that. Item number 9, we need a motion to increase the amount of the Municipal CARES Act program offered to the mayors to a program benefit of 30,000, which includes 30 million, thank God, 30 million. That would be a couple of zeros missing. 30 million, which represents an increase of the loan fund to 25 million and up to $5 million in PPE.
Motion. Motion to approve. Is there a second?
Second.
Is there properly moved and seconded? Any discussion or comment? Not. Cast your vote. Commissioner Houseman,
Yes.
Commissioner Ellis,
Yes.
Commissioner Morris,
Yes.
Commissioner Hall,
Yes.
Vice Chair Arrington, Commissioner Carnes. Yes.
And the motion passes.
Any other items come before us?
No more from executive
Any other
session.
items come before us today?
No further items.
No further items to come before us today. We stand adjourned. What?
He said adjourn. Move to adjourn. All right. 3:41, I do it.
All right.
So we all.
Damn.
Wait,